Hello and welcome to this episode of Transforming Healthcare, the people behind the progress. I'm Thelma Pentney and today I'm delighted to be joined by Julie Bellew, ICT Programme Manager for Telehealth. As Julie prepares to retire later this year, we're taking the opportunity to reflect on her journey, the evolution of Telehealth programme and the impact of virtual wards and the incredible collaborations between clinical and technical teams.
Julie, thank you so much for joining us.
Thelma, thank you so much. It's so lovely to be here with you today.
Julie, you've had a long and varied career, and what are some of those standout moments that stayed with you over the years?
Well, Thelma, there's been so many over the years. I've had a wonderful career within the health service. You know, when I think back to the early days, I came in from, I was in Kells for 2 years and then went out to a new role of IT officer out in County Louth along with other colleagues, the 4 counties of the North East, and that was a whole new service. But I suppose some of the big moments around that were we put the first wireless network in the North East. So I remember being up on top of the Lourdes with Mother Mary Martin, a very large statue, and we put a wireless network in across Drogheda, and that was the first wireless network to go in the North East. Had amazing projects. I had the pleasure and the privilege to work on amazing projects over the years. Maternity system going in, a precursor to the wonderful new one we have now for Lourdes and Cavan. And then it was on to NIMIS. I was asked to get involved from the procurement of NIMIS, and so for over 10 years NIMIS was my everyday.
And just for the benefit of somebody who may not understand what is NIMIS, would you explain that?
NIMIS is the National Integrated Medical Imaging System. So it links all of the radiology departments across the country together, and it's the single biggest system that we have deployed within eHealth. It was a phenomenal project from the start in terms of volume, but it allowed us also to put a lot of shape on the future. It was a very ambitious project. It brought a lot of standardisation with it, and so when I think of some of the things to look back on, there was no full list of GPs available when we started NIMIS, so now the full coding was put in place for us. Working with the precursor of the HUI department now, starting to get all of these standards in place and leaning into any standards that existed. It was a phenomenal. First site go live is one of the big memories I have. Sligo, the 21st of June 2011, the longest day in the year, probably the longest night of the year before making sure everything was okay, but a wonderful go live and a wonderful start to NIMIS. So I feel very proud of that work over in excess of 10 years. I had the opportunity then to work as a deputy delivery director in primary care. I wasn't very long in that role when along came COVID and everything changed at that stage for everybody. So Telehealth called, we needed to keep the services going, we needed to continue delivering care to people at home and in a very different way. So I led out with a wonderful team on video enabled care, and that was really one of the early forays into telehealth for the service. I suppose my start out was electronics anyhow. I did electronics in the Regional Technical College in Dundalk, so I was always technically minded, and worked for 13 years in 2 different American manufacturing companies. So I suppose an interesting part of my past was I was involved in installations of measuring equipment in paper mills in France and in the UK as well. So that was a very different aspect to the experience I bring with me.
So Julie, if you think about telehealth in the early days, what was your vision for it? Or did you have a vision? Did you have a sense of where it could go?
Well, we were actually very lucky. Before the pandemic, the COT organisation, so cooperation and working together, I was involved in the COT project. So they're projects that run either side of the border, and we were very lucky to have engaged on some telehealth in it in advance of the pandemic arriving. So we had started looking at video enabled care. There was very, very early days of trying to think about remote monitoring, and as we know, telehealth is the provision of care where the provider and the recipient are separated by distance. So that was a very early very early use of telehealth, but we were very fortunate to have had that experience, and indeed our partners in Scotland were superb in providing support to us to get started, and indeed we keep those linkages there in place, particularly with the NHS right across all of the UK. Those linkages on telehealth are very important to learn and to gain best practice from each other.
Julie, what are the biggest changes you've seen in how virtual care is viewed and how virtual care is delivered?
Well, I suppose our first reaction was, as part of the pandemic, there really was no choice around it, and it was that or have no service at all. So we saw a decline in the use of telehealth after that, but as people returned to normal and people needed to come back in. But what we're finding is that more and more clinicians are reaching back for telehealth tools to enable them to care in a different way and to use technology to care better for their patients and the service users. There are wonderful projects out there. The virtual wards are absolutely outstanding, and they came from an idea. So 2 of my team had come across some work going on virtual wards in the UK. There was nothing on it here really. I know there was some community work going on, but nothing really in the acute setting. And I remember us working with the Digital Health Clinical Office and putting a paper together for some Christmas reading for the COO and the CIO on what a virtual ward was, and is this something that could be pursued here. That was in December 22, and the first 2 wards went live at the end of June in 24. It was a phenomenal turnaround. I think allowing people who still require acute care to be able to go home and be in their home environment is a wonderful achievement for us. There are fabulous projects right across the whole of the country, led by clinicians. This all needs to be clinically led and supported by ourselves with the support of the service, to enable clinicians to provide care in a different way, and telehealth lets us do that. We know that we have waiting lists, we know that there are so many trolleys there, we know we need to work differently, and to me telehealth is a core component there. It needs to be clinically led though. We're finding amazing projects out there where clinicians are leading. So I think that's probably the biggest change from it being a tool of necessity as part of the pandemic to keep the service going, now to being a tool of choice. And both across the virtual wards and all of the seedling and other projects right across the country, there are so many clinicians using video-enabled care, and it's not one thing or another. And I think that's the difference. In the pandemic, it was all video, and it was all phone calls, and it was nothing else. It's blended care that is really delivering for us at this stage. They're not particularly easy projects to get going. They're easy technology to use, but it takes a lot of effort to get these projects up and running, and a lot of clinical time to get it going. But there are massive rewards there for us and for us all as a service, but most importantly for our patients. We have very close links with our patient partners on telehealth. One of the aspects of telehealth, which is different to the other technology that we purchase and that we provide, is that the biggest users of telehealth are actually our patients. So when we go and we purchase a lab system or a radiology system, the users are within the health service. But with telehealth, the patients and the clinicians are both using it. It's really important that the technology is easy to use, that it is not digitally exclusive, that it can be inclusive, no matter where you are, where you live, or what your ability is, that it is easy and accessible for everybody. And that is a really, really important aspect for us. The telehealth roadmap was published it was actually released on the 1st of December 22, and that laid out, the telehealth steering had asked us to go away and put a plan together what we need to be doing over the coming years. So there was a lot of effort went into that, and a lot of co-design with our patients, with clinicians, with service leads across the country, a lot of research into other countries who had telehealth strategies in place already, and we arrived at a roadmap that will allow us to put good foundations in place and move forward to deliver telehealth for the country. I think we've a huge number of those foundations in place already, and it's absolutely super to see.
You mentioned your server user group and having them so involved. What kind of feedback do you get from the patient or the client at the other end?
Well, we get wonderful feedback, and I suppose that is such an important part. It's important to listen and to learn the whole time. We actually have a recent video on the virtual wards from a lovely gentleman named Tommy in Limerick, and he says he's telling everybody about the virtual ward because he was so delighted to get home, felt so safe and so well cared for by the team. The feedback on it is phenomenal. The feedback on video was absolutely incredible, and I might mention the acute oncology service. It's actually the acute hematology and oncology service who have adopted video into their service. They're live in 19 sites out of 26, and that allows patients who are receiving active chemo to have a video call when they need it with their nurse. That has been a phenomenal success, and a really beautiful lady called Celine Garvey, one of the patients, recorded a video with us about her experience. She was very ill at the time, but she believed so much in it that she wanted to share her journey and to encourage others into it. And unfortunately, Celine passed away, but it certainly is part of her legacy to share that learning. So it's been a phenomenal response. That's why we do all this. We're doing this for our patients and for our service users, for ourselves, for our family, for our neighbours, for our country. And I know that can sound a bit twee, but that's the reality. And that is the difference between working in an American corporation that is focused on profit and working for our service. And from the very start, that has been really important to me. That was the difference. I thought I'd come here into the health service, into the North Eastern Health Board for a couple of months and see what I thought. And 28 years later, I'm still here and I'm still loving it. So I think that responding to our patients is what we're here to do. And you know, there is evidence there as well. It's wanting to be home, and one of our lovely patient partners, her last slide when she's presenting is always recovery, home, the place where recovery starts. And it's so true, but we can see from the studies that are ongoing, if I'm at home, I have a less chance of hospital-acquired infections. I have less chance of losing conditioning, so deconditioning is a really big problem. Lower instances of delirium for patients as well. There are so many benefits, and there's the green knock-on all this as well. So from the environmental perspective, the less travel, less carbon being used, and we are doing studies, and we're linked in actually with the HSC Climate Action Group as well for a lot of the telehealth work that we're doing. And it's such rewarding work, and it's so enjoyable. We have the best colleagues in the world. You never hear no, or if you hear no, it's probably for a really good reason. It's the answer maybe you needed. But we have the best of colleagues, our tech colleagues, our support colleagues, our BizOps colleagues. We're the lucky ones in delivery that are out there delivering. Cyber, all the CISO gang that are there now, you know, it's pushing an open door most of the time, because we have that shared vision and we have that common goal of wanting to improve the care that's been provided and improve delivery of healthcare, and that's our business day in, day out. There's been so many changes as well. When you think of we were the North Eastern Health Board, Loudmead, Cavan, Monaghan, and we were very independent, and we didn't know that many people around the country, and there was always a relationship with the Northwest, and then the Dublin folk, we started getting engaged there, and the HSE came along, and it was all change and very different ways of working, national projects. But there was great collaboration, and it's the name of the game. Collaboration is the name of everything that we do. There's always been great collaboration, and I have to say the close working relationship we have with the Digital Health Clinical Office is immense, and that is the success of telehealth to date is down in no small part to that relationship, that working together, the listening to each other, the being guided, and the building that mutual respect with each other. And it was the same in NIMIS. The clinicians that were involved in NIMIS, that close clinical shared working and shared learning and respect for each other's expertise. And I include our administrative colleagues as well in the hospitals and community as well, that respect for their knowledge. the PAS teams around the country. Like there's so much knowledge out there. It's wonderful. There's wonderful knowledge out there, and people in general willing to share. And if they believe in what we're trying to do, a lot of what we do is bringing people on a journey. And I always have felt we were like the bridge between the service and the technology. So it was to translate what we were doing, what we were seeking to do from a technology perspective, and to bring that closer to the lens of the clinical and the admin colleagues. So it has been super.
So what's the typical starting point of that journey?
Well, it's usually somebody has a dream. Without a vision, the people perish. Isn't that what they say? So it starts with a proposal to have a project agreement. Like there's 3 legs on every stool that I have seen over these years. Service must absolutely be involved. Clinicians must lead, and we must support and guide and drive forward the projects. So those 3 components together, and I know Fran often says if one of those is missing, there's a problem, and that's correct. We need everybody at the party. I think having a shared vision and a common vision, and like building friendships around it as well, building respect and building friendships with people, being obliging and being willing to help each other. And I know we always try to have an atmosphere of a no blame atmosphere. If something is wrong, let's just get it on the table and let's talk about it, and let's see together we'll fix it. Or if I don't know, if I don't understand, I'm usually probably the one putting my hand up saying, I'm not sure, what do you mean by that? Sometimes I should know what it means, but anyhow, I think we're very lucky in digital in that we actually have quite flat structures. So we haven't got this massive hierarchy of, well, I'm the grade 3 and you're the grade 5 and Thelma's the grade whatever, and we don't have that. There's a level playing field, I feel, in digital, and I hope that people right across digital feel that as well. And I think that is our great strength. I think every voice matters, and that people are given the space to speak, and for their expertise to be taken on board. I think that's a lovely part of actually working in digital. And maybe it's because we're a newer side of the service. You know, I know we're 30 or 35 years here, back from the days when you diagnosed a computer. My first diagnosis used to be the sound it was making when a computer was turned on, and people could tell you it went, but then it stopped, and you're going, I think I know what that might be, like crazy stuff. But it's a relatively new service within the wider health service, and I think we play to our strengths on that. And most people love working with us. We're usually coming with a solution rather than a problem. So we're usually very welcome, which is great. And to enjoy our work and work along the way.
How do you see the future for telehealth and virtual wards? You know, if you could jet off 10 years.
What will it be? Tell me, what will it be? 10 years ago, we didn't really think we'd be doing what we're doing today, that acute patients would be going home and be perfectly minded remotely from their hospitals. I see us having hubs that are minding people. I don't see us with a virtual ward in every hospital. I see us with hubs that would be able to support patients both in acute and in the community in that very integrated space. I think when we're in hospital, we're probably all going to be wearing something and be monitored centrally, even though we're in hospital and there are staff looking after us. I think there will be more and more times when we are being managed remotely. I think in 10 years, we'll have our EHR in 10 years. That's going to be absolutely immense for the whole of the country to be able to have that and the shared record coming along. That's superb altogether. So I think even when we think about 2 years ago, what did we know about AI? And AI is snapping here. We should be actually capturing what we can in AI, using AI to the best of our ability to support what we're doing. The days of a blank page starting off are gone. So I think for telehealth, I think I actually don't know for telehealth what it will look like in 10 years, but I'm very glad that it's going to be there, and I really feel it has a firm footing in the future.
Julie, the plans for Centre of Excellence for Telehealth, can you speak a little bit about what that might look like?
Yeah. No, absolutely delighted to, Thelma. We launched the Telehealth Roadmap, and we needed to find out how are we actually going to deliver upon all of the actions, all the foundation that was going to be required in it. Looking to the other centres of excellence that exist within the HSE, we started thinking, well, what if it was a centre of excellence, what would that look like? What would that do for telehealth? And when we looked at what an operating model might be like for a centre of excellence, and we compared that with what we're trying to achieve in the roadmap, the two blended seamlessly together. So it became a bit of a no-brainer. So the Centre of Excellence is the delivery mechanism for the Telehealth Roadmap. It will be a one-stop shop for anybody who is seeking to do anything with telehealth. We think of it like a supermarket. So you might come into the supermarket and say, oh, I want some sugar and butter, I want a license for this, or I want to learn a little bit more about video, or I want some online supports and therapy. So there might be things that you come into the Centre of Excellence and you just take them and go. Or you might go to the counter, you may actually need advice, you may need help, you may have an idea for a big project that you wish to get started. So all of that, we know that we have a lot of resources available. We know there is a telehealth toolkit available that will take you from not using any telehealth day by day, week by week, until you actually have your project implemented. And that is developed for clinicians, that is in their languages, not in project manager language. So access to tools like that, we find a lot of the time people don't realise there are such tools and resources available. So by having the Centre of Excellence, which will be a joint venture with the clinical colleagues, so there will be clinical colleagues in there will be technical colleagues in there, and a service support in it as well. So that's what we want it to be, a one-stop shop. It means for any national programmes or national projects will remain running down through it, but that for anybody who needs help or needs support, that there's help easily available to them. So that's where we're going with it. We have taken a lot of advice from the RPA and AI gang, and from the SAP Centre of Excellence as well. So really looking forward to, I really feel that's the next stage for moving forward, and really look forward to its launch later this year.
Julie, yes. When you reflect back on your career, is there anything that I should have asked you that I didn't ask?
That's a get out of jail free card now, Thelma. Do you know, I suppose as I look back, the most important things are the people that I have worked with, who have been amazing. I call my team the dream team, as you all know, and they are fantastic. Amazing colleagues in the NIMIS team, amazing colleagues throughout all of the areas, like no man is an island. And I think the friendships and the collegiality that we foster together, and that takes time and it takes trust. And I just think there's so much has been achieved. I feel immensely proud of the work. I feel awfully proud of the work that has been my pleasure and my privilege to carry out over the years.
Julie, thank you for sharing your insights, your experience, and for the incredible contribution that you've made to the HSE and to digital healthcare in Ireland. So on behalf of all of us in technology and transformation, and the wider HSE, and the people who will benefit from all the wonderful work you have done, thank you, and I wish you the very best for the future.
Thelma, thank you so much.